Hello everyone, welcome back to my channel, that is Obstetrics and Gynaecology Simplified. Today we will discuss about menopause and HRT, that is hormone replacement therapy. Okay, so let's start. What is menopause? Coming to the definition of the menopause, we will discuss about the definition, physiology of menopause, stages, that is the straw criteria, and clinical features, investigations, complications, and the management, that is the lifestyle modification and hormone replacement therapy that can be given in menopause. Okay, so what is the definition of menopause? It is the permanent cessation of the menstruation. Okay, I've taught you about the menstrual cycle. So when the menstrual cycle is stopped for consecutive 12 months, okay, for 12 months, if it is the permanent cessation of the menstruation for 12 months consecutively due to loss of ovarian follicular activity, that is called as menopause. So let's write it down. It is the permanent cessation of menstruation for 12 consecutive months due to loss of ovarian follicular activity. Okay, due to loss of follicles, what happens that due to the atresia or the apoptosis of the follicles, gradually, that is what happens when we are in the young stage or during the intrauterine life, there are more amount of follicles. Okay, there are millions of follicles. Then gradually at birth it decreases to thousands. Then during the reproductive phase it decreases to hundreds, and then during the menopause, due to continuous apoptosis of the follicles, okay, that decreases. So follicles decreases and there is no follicles left in the ovary and there is no menstruation. Okay, so there occurs menopause. What is the normal age of menopause? In India, the average age is 47 years, but worldwide it is 51 years. So this is a very potential question in MCQ. Remember this, in India it is 47 years and worldwide it is 51 years. What is premature ovarian insufficiency? See, in the term itself, we can able to discuss, that is, what is premature means the normal, the average age of menopause, it is 47 years. So if before that prematurely, okay, prematurely, if the ovary is not functioning, it is called as premature ovarian insufficiency. So what is the age for premature ovarian insufficiency? If the menopause occurs before 40 years of age, that is called as premature ovarian insufficiency. So between 40 to 47 years, what is the term that is called? That is called as early menopause. So before 40 years, it is the premature menopause or premature ovarian insufficiency. Between 40 to 47 years, that is the early menopause, and 47 years to 51 years, it is till 55 years, that is late, that is the age of the menopause. And what is late menopause? If that occurs more than 55 years of age. So let's write it down. If what is premature ovarian insufficiency? If menopause occurs less than 40 years. And what is early menopause? That is if it occurs between 40 to 45 or 47 years. And what is surgical menopause? Surgical menopause is due to bilateral oophorectomy or hysterectomy. And perimenopause is the transition of menopause, that is between the late reproductive phase, and then the perimenopause starts, and then comes the menopause. So it is the transition between reproductive age to menopause or postmenopause. That is the transitional phase, that is called as perimenopause. So what is the age? That is the 2 to 8 years. 2 to 8 years before menopause. And what is late menopause? That is if more than 55 years and still the menopause has not occurred, that is the late menopause. Okay, understood? Then coming to the physiology. So what are the things that occurs in the ovary, as well as what are the physiological changes during the reproductive phase, and during the early reproductive phase, during the late reproductive phase, during the early menopause, during the late menopause? What all things, or what all changes, what are the hormonal changes that occurs in the ovaries, so that the final function that leads to menopause, and finally the hormonal changes that takes place, I will be discussing here. So what are the ovarian changes that occurs? First, see, due to follicle depletion, why? Because of due to apoptosis. What happens then? See, I've told you in the physiology class that if this is the ovary, then here are the follicles that are present. Okay, so these are the primary or primordial follicles. These all are the small at the preantral and antral follicles. Then these are the mature follicle or Graafian follicles. So these secrete what? Estrogen, and the pituitary that releases FSH that acts on the follicles, and they release estradiol or E2. What happens? Due to depletion of the follicle depletion, what happens? This does not work. So there is follicles are absent. So what happens? The estradiol levels decreases. Estradiol is decreased. So there is decreased E2 or estradiol. So if there is decreased estradiol, then what will happen to the FSH levels? There will be loss of, it provides a negative feedback. So what happens? Due to loss of the negative feedback, there will be increase amount of FSH. So there will be decrease estradiol as well as inhibin. Why? Inhibin is also secreted by the follicles, inhibin B. So estradiol and inhibin B are decreased, and due to loss of negative feedback, what happens? The FSH and LH levels are increased. Okay, so what are the hormonal profile changes? See what happens. There is increase in FSH. Okay, that is more than 40 international unit per liter. It is the diagnostic of menopause. But we usually don't do FSH for diagnosing menopause, because we clinically diagnose. Okay, the principal criteria for diagnosing menopause it is purely clinical. That is the menstrual changes that occurs. First, there occurs in perimenopause. There will be menstrual irregularity. There will be amenorrhea, oligoamenorrhea. Okay, and then later on, total or complete absence of menstruation, that we call as, and for 12 months. For 12 months consecutively, we call as menopause. So we diagnose it clinically. So the principal criteria is menstrual changes, not the hormonal endocrine changes. Okay, so you must remember that usually FSH is not used for diagnosing the menopause, but if a patient complains of cessation of the menstruation before 40, that is in premature ovarian insufficiency, the gold standard investigation for diagnosis is FSH. And what is the level? The level is more than 40 international unit per liter. That is diagnostic. Okay. So increase in FSH. And then also LH level will also increase due to loss of negative feedback, and there will be decrease in estradiol and decrease in inhibin B. So in post-menopausal women, we will find these all hormonal changes. Okay. Then let's come to straw criteria. See, what is straw criteria? Straw. Full form of straw is stages. Okay, stages of reproductive. Okay, stages of reproductive aging workshop. So what it said? It said that it is used for the transition of reproductive cycle to menopause or postmenopause. So it has 7 stages. So this defines the menopause based on the woman's menstrual cycle and the hormonal changes that takes place. So these are the criteria. Means there are two criteria. So, okay, here there are 2 criteria and 7 stages. So what are the stages? You see here. This is the straw criteria. Why it is used? See, these are the stages. That is from -5 to -2. -5 to +2. Okay. So -5, -4, -3. Okay, for 3 it is 3b and 3a, -2, -1, +1, for +1 it is, and also 0. 0 is there, 0 is here. Okay, 0 is here, and 0, +1 and +2. +1 is again divided into 1a, 1b and 1c. So see, just don't panic by seeing this. It is very simple. You just need to know some basic things from here. Okay, just don't see this and panic. I will be simplifying it for you as the channel name, Gynaecology Simplified. Okay, so see here, just see, these are the terminology, that is reproductive, menopausal transition and postmenopause. Okay, so these are the 3 stages, that is the reproductive phase, the perimenopause or the menopausal transition phase, and postmenopause. Okay, the 3 stages you understood. Then the reproductive phase, it is again divided into early, peak and late. So this is the early reproductive phase, this is the peak reproductive phase, and this is the late reproductive phase. From -5 to -3b, it is the early peak, and -3a, it is the late reproductive phase. Okay, so what is the menopausal transition? From -2 to -1. These are the menopausal transition, and 0 is the, see, this one is the final, FMP is the final menstrual period. This is the stage 0. So this is -5, -4, -3, -2, -1, 0, 1, 2. So these are the 7 stages. Okay, fine, understood. What are the 7 stages? And 0, it is this is the menopause, final menopause period. So before that, it is the reproductive and transition, and then post 0, that is the postmenopausal phase. Okay, and from +1 to +2, it is the postmenopause phase. Understood till this? So duration, you just remember that the reproductive phase, it is variable, and even the menopausal, early menopausal transition, that is here -2, that is also variable. just remember the late menopausal transition that varies from 1 to 3 years. And the postmenopausal phase, that is also divided into early and late. The first 5 to 6 years, that is the early, and after 6 years, remaining part of the life, after 6 years of menopause, let the patient has achieved menopause at 47 years. Okay, so from 47 years till 6 years. Okay, that is the what? That is the early postmenopausal phase. And late means the remaining lifespan till she dies, that is the late menopause phase. So it has a clinical significance. So I'm just emphasizing it because in the early postmenopausal phase, the maximum chances of the vasomotor symptoms and other postmenopausal symptoms are highest. Okay, so this is the phase, the early postmenopausal phase, that is the phase where the postmenopausal symptoms are highest, and later on it decreases. Okay, so duration understood. And there are two criteria, as I have told you earlier, that is the principal criteria and the supportive criteria. See, the endocrine thing or the hormonal thing, FSH, inhibin B, AMH, okay, LH, all these are the supportive criteria. We do not do regularly in the menopausal woman just to diagnose menopause. We can do it clinically. So the principal criteria is the menstrual changes. So this is the menstrual cycle. So what happens in the menopausal transition? There is variable length of the cycle, that is more than gradually the variability increases. In the early menopausal transition, it is more than equal to 7 days, and when it increases to more than 2 months or 60 days, okay, more than equal to 60 days, then it is the late perimenopausal phase. Okay, I think I just have mentioned the final menstrual period as here. This is not here. I'm really very sorry. See, final menstrual phase, it is the 0, lies between -1 to +1. Okay. So here is the final menstrual phase. It has been drawn already here. I just by mistake told that here it is the menstrual final menstrual period. So my apology. Okay, so the final menstrual period is here. You must have been understood by now. Okay, so if it is more than 60 days, then it is the late menopause or late perimenopausal period. Then after that, here no menses. Okay, got it. Then coming to the supportive criteria, I have told you that there are changes of FSH, AMH and inhibin B. So there is during the late reproductive phase, that is from -3B to the perimenopausal age, what happens? There is decreased level of AMH and inhibin B. It decreases as the number of follicles decreases. So AMH and inhibin B. AMH is also secreted by the follicles, preantral and antral follicles. They also gradually decrease by the age. So there is decrease in the what? AMH and inhibin B gradually. There is so when the AMH and inhibin, it gradually is decreased, so the FSH gradually increase. So during the late reproductive phase, there is no such increase in FSH, but in the late perimenopausal age, that is the stage -1, what happens? There is increase in the FSH level, that is more than 25 international unit per liter. Then what happens? In just post menopause, there is increase in FSH, that is more than 40 international unit per liter, and thereafter it stabilizes or remains constant. Okay, then similarly antral follicle count, there is low, and it is very low post menopause. And what are the descriptive characteristics? That is symptoms, the vasomotor symptoms. See, the vasomotor symptoms are most common in the early. So most likely it is in the early postmenopausal phase, that is from 2 years to 6 years. Okay. And later on during the +2 stage, okay, after 6 years, there is increasing symptoms of the urogenital atrophy, that is urinary as well as genital organs, the atrophy due to decrease estrogen or estradiol. So that we do symptomatic treatment, that I will be telling you in the HRT section. Okay, understood the straw criteria. Now coming to the premature menopause. So what is premature menopause? It is premature menopause. I have told you earlier that if menopause occurs before 40 years, that is premature menopause. So how will we confirm that? We will confirm by taking two samples of FSH, that is 1 month apart. 1 month apart, we will be taking 2 samples of FSH. If it is more than 40 international unit per liter, then it is menopause and it is gold standard. Okay. So what are the causes of premature menopause? See, premature menopause, it is definitely, it is not physiological. So that may be due to genetic, autoimmune, surgical, as well as iatrogenic conditions, or maybe due to infections and metabolic disorders. So what are the genetic conditions that may lead to premature menopause? That may be Turner syndrome, and Fragile X mutation, autoimmune diseases like thyroiditis and Addison's disease. What about the surgical? Bilateral oophorectomy, hysterectomy, and iatrogenic chemo or radiotherapy. Okay, these all causes premature ovarian insufficiency or premature menopause, and the treatment is we have to give HRT till normal age of menopause. Okay, till 51. In India it is 47 years to 51 years we have to give HRT, that is supplemental. HRT is low dose of estrogen and progesterone that we give or supplement because estrogen is decreased in menopause. Okay. So what are the clinical features of menopause? First, coming to the vasomotor changes. Okay, that is the clinical features, means what are the changes that occurs? See, what is vasomotor symptoms? The vasomotor symptoms, see, vasomotor symptoms occurs, okay, this occurs due to, I've told you the stage where the vasomotor changes occurs. This occurs due to vasodilation of the peripheral vessels. Why? Because due to decrease in estradiol level, there is due to estrogen withdrawal or decrease in the estrogen level, there is disturbance in the hypothalamo pituitary axis. Which center? The thermoregulatory center. Okay, so there is imbalance of the thermoregulatory center in the hypothalamus pituitary level. Then what happens? There is vasodilatory surges that occurs. So due to which there occurs symptoms like hot flushes, palpitations, and see, this is the most common cause for which HRT is given. Okay, this is the most common cause, that is the vasomotor changes or the vasodilatory changes that occurs due to the hypothalamic thermoregulatory center disturbances for which we give HRT. Okay, and what are the menstrual changes that occurs? The menstrual changes that occurs is the irregular cycles, oligomenorrhea and amenorrhea. Okay, then what is urogenital atrophy? Also called as genitourinary syndrome. This is a short note, that is GSM, genitourinary syndrome of menopause. Okay, this is a short note. So, what are the symptoms in genitourinary syndrome of menopause? That is, symptoms are vaginal dryness, dyspareunia. Due to dryness, there will be dyspareunia or painful intercourse and recurrent UTIs and stress and urge incontinence. Okay, so what is the treatment? We give local estrogen. Details I will be discussing in HRT. Okay, in HRT I will be discussing the dose as well as the formulations. Then sexual dysfunction, there will be decreased libido and there will be decreased libido as well as there will be poor lubrication, arthralgia and osteoporosis that occurs in the in the musculoskeletal part. Osteoporosis and arthralgia. Okay, then coming to the investigations. So, do we need to investigate the menopausal woman? No, not always. We don't need to test for menopause. As I've told you earlier, that menopause will be clinical diagnosis. Okay, so clinically by the menstrual changes we diagnose the menopause. So when to test? We have to test if in premature ovarian insufficiency. Okay, we will test. And in secondary amenorrhea and if any atypical symptoms occurs, then we have to test for menopause. Okay, so what are the investigations? That hormonal profile that I have told you earlier we will do. Okay, apart from that is from FSH, we will do FSH and estradiol levels. Apart from that, we also do thyroid and prolactin, because we have to rule out the other causes of premature menopause as well as the lipid profile. Okay. And DEXA scan. For osteoporosis after the age of 65. Okay. Or earlier, if any high risk is present, we can do it. But for the risk of osteoporosis, we have to do. Then what are the complications? Complications, that is the long-term complications of the estrogen deficiency. Long-term complications of estrogen deficiency is first osteoporosis. Okay. So in osteoporosis there is increased, why there occurs osteoporosis? Because of increased resorption of bone. So why? Because the bone resorption occurs because of increase in estradiol levels. And which bone? The vertebral bone fractures are most common. So remember this, the vertical bone, it is more common. Vertebral bone fracture, it is more common. And what will be the DEXA T score? It will be less than equal to minus 2.5. It is diagnostic of osteoporosis. The treatment I will be telling you later along with the HRT. Okay. And then coming to the second complication, that is the cardiovascular changes. Cardiovascular diseases. So what happens? Due to decrease in estrogen level, there is loss of cardioprotective effect. Okay. So there is decrease cardioprotective effect, and also there is decrease in the good cholesterol. HDL is decreased, LDL is increased, and triglyceride is also increased. So there is increased risk of MI and stroke. Increased risk of MI and stroke. And then coming to the metabolic syndrome like type 2 diabetes, central obesity, insulin resistance, these are more common in case of menopausal women. Okay. Metabolic syndrome, insulin resistance. And then there is genitourinary syndrome, as I have told you earlier. Genitourinary syndrome of menopause. Okay. The symptoms I have told you earlier, so just the mention. And then the cognitive dysfunction. There will be loss of memory. Okay, increased risk of dementia, late onset dementia. Okay, these are more common in menopause. Then we will discuss about the management of menopause in the next video. Okay, keep learning.